Alright, hey guys, so I will be doing my presentation on physician-assisted suicide. So the first question obviously is, what is physician-assisted suicide? There is a big difference between that and euthanasia. People tend to get the two of them mixed up. So euthanasia is where the physician performs the entire intervention. They give the patient the means or the information to commit the suicide, and they actually do it for them. But physician-assisted suicide is where the physician gives the patient the information or the needs, but they don't actually commit the act. The patient is the one that does it. So there was federal action with the 1997 Supreme Court. They said that they recognize that there is no federal constitutional right to physician-assisted suicide, but they affirmed that states could legalize it through legislature, state by state. So currently there are 3 states that have legalized physician-assisted suicide through legislature, and that's Oregon, Vermont, and Washington. And there's 1 state that has it legal through court rulings, and that's a case-by-case thing, not all around, and that's Montana. Then the rest of the 46 states say that it is illegal, but there are 4 states within that 46 that don't have any specific rules on it. They just say it's illegal. So state by state, Montana, Oregon, and Vermont, and Washington all have a residency requirement, but the thing is, with that residency requirement, there is no minimum. They just have to live there. And then all of the ones that have it legalized through legislature, so Oregon, Vermont, and Washington, say that there's a minimum age of 18. The patient has to have a 6 months or less diagnosis left to live, and they have to have 2 oral and 1 written prescription recommendations from a physician. Montana doesn't have any requirements for age, life expectancy, and a written recommendation from a doctor. So some statistics, 57% of physicians practicing today have had a request for physician-assisted suicide in some form or another, and thinking about it, that's a huge statistic, thinking of how many patients there are and how many physicians there are. That is a huge percentage. And in Oregon, there has been a 30% increase in the number of assisted suicides since 2009. In 2009, there were 59, and in 2012, there were 77. Over the 3 years of legality in Vermont, 255 prescriptions have been written, and in a new study that was just done there, doctors found that only 60% of their patients actually chose to use those. So of those 255, 40% of those people decided that they did not want or did not need to use those prescriptions. So there are 2 principles of medicine that a lot of the doctors say is in favor of physician-assisted suicide. The first of those is that physicians have an obligation to relieve pain and suffering and to promote dignity of dying patients in their care. And the second is the principle of patient bodily integrity, which pretty much says that physicians have to respect patients' competent decisions to forego life-sustaining treatment. So with the 2 of those, it's pretty much saying, hey, if this patient is in a lot of pain and wants to die and is competent enough to say so, those doctors feel as though that they have the responsibility to help that patient. And then on the other side, there are 3 opposition arguments. The first is the slippery slope argument, and that's pretty much saying, if we help this person that has 6 months left to live, why not help this person that has 2 years left to live, and then eventually it'll be 3 years, 4 years, 5 years, and whoever else knows how long. The second opposition argument is prejudices against the disabled, and that's pretty much saying, oh, if we can kill someone because they are dying of this, why can we not help commit suicide for someone that is disabled because they don't have the competency to be able to say that they would like to have physician-assisted suicide as an option for them. And then the third is conflict of interest, which is pretty much the opposite of the 2 principles of medicine, which says we are doctors because we are here to help people, not to help people die. We need to save them, not kill them. And then a really big thing that I was going to show you a clip of, but now we're doing them online, is suicide tourism. And this is a huge thing in Switzerland with an organization called Dignitas. It helps terminally ill patients to die by providing counseling and the lethal drugs to commit suicide. This organization is one of the only ones that will accept foreigners who are not only terminally ill but severely mentally ill or clinically depressed beyond treatment. And because of scrutiny from the US and the UK, they only accept the most extreme and desperate cases. There is a movie called The Suicide Tourist, which is a movie based on the life of Greg Ewert. He was diagnosed with ALS and was given 2 to 5 years to live. And then after a very rapid decline in his health, after 6 months, he decided he wanted to end life on his own terms. So he went to Dignitas for help with his wife, and the movie pretty much just follows his journey to Switzerland and his eventual suicide, and how everything affected his family and his friends, and especially his 2 children that are in the movie that talk about how this act affected their lives in a negative way. So that's pretty much all I have. If you have any questions, let me know.